So what is osteoarthritis? To understand osteoarthritis, you need to first understand what a normal joint looks like. In the diagram you see here, you'll notice that the joint is surrounded by a joint capsule that essentially holds the joint together. On the inside of the capsule is the synovial membrane, which has an extensive blood supply and functions to produce the synovial fluid. The synovial fluid is the thick fluid within the joint space that functions to reduce friction between the bones, provide shock absorption between the bones, and provide nutrition to the articular cartilage. The articular cartilage provides a smooth, lubricated surface for joint movement. In cases of osteoarthritis, we begin to see joint space narrowing and thinning of the articular cartilage. As the condition progresses, the joint space is eliminated, resulting in the bone ends rubbing together and the development of bone spurs. Now, there are many reasons for these changes, including previous trauma, weight gain, and even genetic considerations. But there are two primary causes of osteoarthritis that I want to concentrate on. First, and probably most significantly, is the fact that the character of the synovial fluid changes from that of a motor oil thickness to one of water. As we age, our bodies begin to lose their ability to produce certain elements. With respect to our knee joints, one of those elements is hyaluronic acid, which is responsible for maintaining the motor oil thickness of the synovial fluid. As a result of this change in the viscosity of the synovial fluid, the lubricating and shock-absorbing capacity of the joint is significantly reduced, which in turn results in the articular cartilage having to take on more of the load. Over time, this results in a breakdown of the cartilage, leading to pain, swelling, and limited range of motion. Imagine what would happen to your car if there was no oil to lubricate the moving parts of the engine. Can you hear the loud clunking, knocking, and grinding sounds coming from underneath the hood of your vehicle? Hearing the clunking and grinding sounds when you're walking, climbing stairs, or squatting is the first sign of your knees starting to wear out. So when you start to notice the snap, crackle, and pops in your knees, your body is telling you that your knees need some attention to help reduce the risk of serious damage down the road. The second reason for cartilage breakdown is uneven wear and tear. Like your car tires where you see uneven tread wear due to the tires being out of alignment, the same holds true for the weight-bearing joints of our body. Here in this example of an individual with knock knees, more of the weight-bearing load is shifted to the outside part of the knee, while for bow-legged individuals, just the opposite is true. The weight-bearing load is shifted to the inside portion of the knee. Over time, improper alignment leads to pain, instability, and degenerative changes in the joint. Now that we know a little more about what osteoarthritis is and how it progresses, let's turn our attention specifically to how it affects the knee. The knee is the most susceptible of our weight-bearing joints to osteoarthritis. Why? Well, given the fact that you've been walking since you were a year old and the wear and tear that goes along with all that time on your feet, it's no wonder that your knees eventually wear out. And then when you begin adding things like previous injuries, age, gaining weight, and some of the knock-kneed and bow-legged deformities like we talked about earlier, can you see how your knees take an absolute beating over the years? When you present to your doctor with complaints of knee pain, one of the first things they will do is obtain some x-rays of the knee. If osteoarthritis is present, they will see joint space narrowing, the destruction and potential cyst formation in the bone lying just under the articular cartilage, and the formation of osteophytes or bone spurs, which are the body's attempt at repairing and stabilizing the joint. Once your doctor detects the presence of osteoarthritis, they will then use a grading system developed in the 1950s and later adapted by the World Health Organization to determine the stage of the disease. The stages range from grade 1 to grade 4, with grade 4 being the most severe. Here's an example of an x-ray of a normal knee. You'll notice the presence of a nice, healthy joint space on both the inside and outside aspects of the joint, along with nice alignment of the thigh bone and the shin bone. Contrast that healthy joint to a grade 3 and a grade 4 joint, and you can clearly see the differences. You can see the significant reduction in joint space, the presence of large bone spurs, and the inside shift of the thigh bone. Now, once a diagnosis has been determined, treatment is then recommended, and as you'll see from this list of what's commonly prescribed, the treatment options are pretty limited. And as the condition progresses and symptoms worsen, most treatment roads end in surgery, as it did for Don, who ended up having joint replacement surgery in both of his knees. So now that you know what osteoarthritis is, how it affects the knee, and the limited treatment options available, you're probably asking yourself, is there anything that can be done for my knee pain? Well, the good news is that there is a revolutionary medical breakthrough that is rapidly changing the lives of knee pain sufferers around the world. Introducing the Advanced Arthritis Relief Protocol. The Advanced Arthritis Relief Protocol is our proprietary medical treatment that deals with the process of restoring, protecting, and maintaining joint health by stimulating the body's own repair mechanisms to functionally heal damaged joint structures. The Advanced Arthritis Relief Protocol consists of 5 sequential steps that I'm going to briefly walk you through right now. Step 1 of the Advanced Arthritis Relief Protocol is a 2-part screening procedure called an arthrogram that we use to determine if there are any small tears in the joint capsule. If a tear is detected, it's an indication that the Advanced Arthritis Relief Protocol will not work and automatically disqualifies the person from advancing to the next step of the protocol. Step 2 of the Advanced Arthritis Relief Protocol is joint fluid therapy, which involves a series of 3 to 5 injections directly into the knee with the goal of transforming the synovial fluid in the knee back into its original motor oil consistency. This results in better cushioning for the joint, better lubrication for the joint surfaces, restoration of normal joint function, and a significant reduction in pain. According to research conducted by the American College of Rheumatology, along with 2 landmark studies published in the Annals of Rheumatic Diseases and the Journal of Pain Research, joint fluid therapy has no negative interactions with your current medications, is non-allergenic, and pain relief can last for years. Step 3 of the Advanced Arthritis Relief Protocol is joint decompression using unloader bracing, which helps to reduce pain by shifting your weight off the most damaged portion of your knee. You can see the effects of bracing in these before and after X-ray images. The use of unloader bracing has been shown by numerous studies to be an effective treatment to decrease pain, maintain activity levels, and increase overall physical health. And the importance of staying active can't be overemphasized when the National Library of Medicine reports that you're 11% more likely to die from being inactive. So, assuming you are a candidate for treatment, you can expect up to a 70% improvement in your condition, which could be all the difference you need in order to return to the activities you enjoy. So let me ask you, if you were to have 70% less pain and were able to be 70% more active, do you think your life would change? What would you be doing today that knee pain has prevented you from doing? Now, while a 70% reduction in pain and improved function is a fantastic response by any medical standard, the real question is, could it get better? And the answer to that question is absolutely. Which brings us to step 4 of the Advanced Arthritis Relief Protocol, which is the optional use of orthobiologic therapy, which taps into and stimulates the self-healing properties of your body. And the easiest and most economical orthobiologic therapy is your own platelet-rich plasma, or PRP, which we acquire from a sample of your own blood. So, while joint fluid therapy is protecting and providing more lubrication to the joint surfaces, the PRP is stimulating your body's ability to repair damaged structures. Studies published in several international medical journals cite decreases in joint pain, decreases in cartilage destruction and bone damage, along with improvements in functional outcome scores. Best of all, when combining PRP with joint fluid therapy and knee bracing, the positive response rate increases to 88% or better. Finally, Step 5 of the Advanced Arthritis Relief Protocol is a weekly series of exercises you can perform at home. These simple exercises are designed to improve your range of motion and flexibility, increase your strength, and improve your ability to perform your daily activities. So to summarize, the Advanced Arthritis Relief Protocol uses 5 simple, properly sequenced steps for alleviating your knee pain. Step 1, contrast arthrogram to make sure you're a candidate for the program. Step 2, joint fluid therapy to reduce pain and improve joint lubrication and cushioning. Step 3, joint decompression to relieve pressure on the most damaged portion of the joint. Step 4, the optional use of PRP to stimulate your body's natural healing response. And Step 5, a weekly home exercise program to help you regain range of motion, flexibility, and strength. So at this point, you may be wondering if this treatment will work for really serious knee pain. Here are a couple of case studies that demonstrate just how effective the Advanced Arthritis Relief Protocol is on severely arthritic knees. The first is an 86-year-old female who was very overweight, bound to a wheelchair, and in a nursing home. You can see here she was big-time bone-on-bone, and she was not a candidate for surgery because she had a titanium rod you see here from a previous fracture of her femur or thigh bone. In most medical circles, this would represent a really hopeless situation. So, with no great alternative and really nothing to lose, she agreed to treatment, and here's what happened. Over the next 2 years, her condition began to improve. You can see here that some of her joint space had been restored, but what I want you to see is how much healthier her actual bones are compared to what they were before. You can see the differences here. Before, the bones were dark, whereas here the bones are white, indicating greater bone density. Now, why is that? Well, it's because she was walking again. She had lost over 60 pounds and was no longer confined to a wheelchair. A truly amazing case study that demonstrates how effective the Advanced Arthritis Relief Protocol could be for someone suffering with debilitating knee pain. Here's another case study of an 80-year-old male patient. You can see the effects of treatment in these before and after images where he went from almost bone-on-bone to a significant amount of joint space. These results were over a 3-month period and enabled him to return to golfing and other physical activity he had not been able to do for several years.